East Coast Radio, and we're joined now by Netty Mepham, the Manager of Integration and Partnerships with Southern New South Wales Local Health District. Netty, thanks so much for joining us today.
Thanks for having me, James.
So, Southern New South Wales Local Health District has a new way of reporting COVID-19 figures. What's the new system?
So we report our numbers based on the number of patients that are being monitored by our virtual care team across the district.
Okay, so what does that mean, cases under virtual care?
Sure. So this is an extension of our community health service where we provide care remotely to patients so they can remain at home while they're isolating with COVID-19. And our staff can monitor them from a distance, either through a video conference call and also measuring their observations, their clinical observations. And we do daily calls just to make sure that they are remaining well. And if they're not remaining well, if their symptoms are worsening, then we can instigate some other interventions to keep them safe at home or transport them to hospital for their medical care.
So, Netty, for instance, when this change came in yesterday, numbers in the Eurobodalla dropped from roughly 24 active cases to 3. So what has happened to those 21 cases, or how do you differentiate those 21 to the 3?
Okay, so we actually had quite a few discharges from our service over the weekend. Many of our cases had reached their 14 days. If you can cast your mind back a couple of weeks, we had an influx of numbers over a period in the middle of September, and so many of those cases have reached that stage that they can be released from isolation.
So they're essentially recovered cases?
Yes.
Yep. And Netty, can you tell us why this change is being made?
That's not a question I can answer, James. I'm not sure why that has been. I might need to refer back to my colleagues for that one.
Yeah, no worries. Look, if I had to have a stab in the dark, I'd say, New South Wales Health, as well as the wider community, is having to make a change towards, living with COVID, and possibly there's going to be more cases. Do you expect to see more cases and more venues of concern now that things are opening up again after we've hit the 80% vaccination target?
I think it's likely that our case numbers will go up across the district and obviously across the state. The challenge will be around people identifying that they might be positive. If they're vaccinated, they may not have the acute onset of symptoms that we've seen previously. So it's going to be challenging for people and for health staff as well. But yeah, I do think case numbers will increase again.
And New South Wales Health will no longer share casual contact locations or venues of concern on Facebook. Where will the community be able to go to find that information? So
all of that information will be available on the state New South Wales Health site and the New South Wales Government sites. Close contacts will be notified by Health and venues will be notified as well.
Netty, thanks for clearing a few things up for us. Is there anything else you'd like to add?
One of the things that I would like to add, James, is that although this service is web-based, we do have other options, because I know for many of your listeners, they will be coming from vulnerable situations. They may not have access to technology, or they may not have the data or the funds available to support. But we are able to support many patients from all different backgrounds to use the technology and to be able to be linked to health so that they can be supported in that 2-week period. For many of our patients, having been diagnosed with COVID is quite an anxiety-provoking time, so being linked in with some health professionals to talk about their worries, but also to know that they're being cared for is really important to them.
That's great, Netty. Thanks so much for your time. Thanks for joining us today.
Many thanks, James.